Imagine clearing your sinuses in seconds by putting garlic up your nose. Sounds bold, right? In this video, we test that claim with real science and real risks. There is a bonus at the end, so stay with me. Here is our roadmap. First, why this hack feels like it works. Second, what physiology and clinical research actually show. Third, safe and proven options you can use today. Disclaimer. This video is for education only and is not medical advice. People on social media say garlic pulls out thick mucus in minutes. They say their nose suddenly feels wide open. They post dramatic before and after clips. Public health experts at the Food and Drug Administration have warned that homemade nasal practices can be risky when they are not sterile or not evidence-based. Clinical guidance from the American Academy of Otolaryngology, Head and Neck Surgery, explains that quick fixes rarely treat the real cause of congestion, which is often swelling of the nasal lining rather than a plug of mucus. When raw garlic sits on the nasal lining, it stimulates the trigeminal nerve endings. That sting triggers reflex tearing and reflex rhinorrhea, which means your nose and eyes water to wash the irritant away. According to a classic experiment published in the Clinical Otolaryngology and Allied Sciences Journal, strong nasal stimulants can make people think airflow improved even when it did not. A controlled crossover study in the Canadian Respiratory Journal showed that menthol, another powerful trigeminal stimulant, changed the feeling of openness but did not improve measured airflow through the nose. Here is the key difference. Sensation is subjective. Airflow is measurable. Garlic can heighten sensation while leaving airflow unchanged. The Canadian Respiratory Journal trial measured airway resistance and found no objective improvement after menthol, which models the same sensory trick that garlic creates. According to the Clinical Otolaryngology and Allied Sciences Journal study, the cooling or burning note can fool the brain into sensing relief. If you appreciate myth-busting with citations, please hit subscribe and turn on notifications so you never miss the next deep dive. Chemistry time. Garlic contains allicin and other sulfur compounds that can damage bacteria and some viruses in test tubes. However, the Cochrane database of Systematic Reviews Journal concluded that clinical evidence for garlic in the common cold is very limited, and that laboratory potency does not equal safe and effective treatment in people. Experts at the American Academy of Otolaryngology Head and Neck Surgery emphasized that the dose needed to kill pathogens on the mucosa could also injure that delicate tissue. There are no randomized trials showing that garlic placed inside the nostrils improves nasal airflow, reduces symptom scores, shortens a cold, or treats sinusitis. A review in the Cochrane database of Systematic Reviews Journal found only limited evidence for ingested garlic and found no trials of intranasal cloves, crushed garlic, or garlic oil for congestion relief. That evidence gap means claims online are not backed by controlled studies. The sensation you feel is most likely irritation, not true decongestion. Garlic is a strong irritant. Occupational data from the Centers for Disease Control and Prevention. National Institute for Occupational Safety and Health report show that garlic vapors can inflame eyes and airways and can provoke allergy and asthma in workers. Ear, Nose, and Throat Journal. Reports and case descriptions warn about chemical burns and ulceration when pungent agents stay on mucosa for too long. Specialists at Harvard-affiliated Massey and Ear have explained that plugging the nose with garlic can also trap mucus and bacteria against swollen tissue, which may worsen irritation rather than help. Oils can travel into the airway when you inhale. A case described in the Beijing Medical Journal documented exogenous lipoid pneumonia from chronic nasal oil drops. The Food and Drug Administration reminds consumers that products placed in the nose must be sterile and formulated for nasal use, which most kitchen oils and herbal oils are not. Allergy specialists note that concentrated essential oils can trigger contact dermatitis and can irritate sensitive noses, especially in people with allergic rhinitis and asthma. The Cochrane database of Systematic Reviews Journal found insufficient evidence that garlic shortens colds, and the Mayo Clinic explains that most viral colds resolve in 7 to 10 days with supportive care. For allergies, antihistamines and steroid nasal sprays reduce the inflammatory swelling that causes obstruction, as outlined by the American Academy of Otolaryngology Head and Neck Surgery. When a true bacterial sinus infection is suspected, Clinicians may combine symptomatic care with antibiotics when indicated, according to Mayo Clinic guidance, not with intranasal garlic. Emergency clinicians report removing foreign bodies like food pieces, including garlic cloves, that patients could not retrieve safely. Dermatology case literature described full-thickness skin burns after garlic poultices, and ear, nose, and throat specialists caution that similar chemical injury can happen on nasal mucosa if garlic is left in place. The Beijing Da Xue Shui Bao Yi Shui Ban Medical Journal described lipoid pneumonia from chronic oil drops in the nose, which illustrates why oily garlic preparations are not a safe alternative. High-volume saline rinses can reduce symptoms by flushing allergens and thick secretions. A meta-analysis in the American Journal of Rhinology and Allergy reported that hypertonic solutions can modestly outperform isotonic solutions for symptom relief, though mild burning is more common. The Food and Drug Administration states that you must use distilled water, sterile water, or previously boiled and cooled water for neti pots and squeeze bottles to avoid rare but serious infections. The American Academy of Otolaryngology Head and Neck Surgery recommends regular device cleaning and gentle technique to protect the lining of the nose. For allergic or chronic inflammatory congestion, daily steroid nasal sprays such as budesonide or fluticasone reduce swelling over days and weeks, as explained by the Mayo Clinic. Guidelines from the American Academy of Otolaryngology Head and Neck Surgery endorse intranasal corticosteroids as first line for allergic rhinitis and chronic rhinosinusitis with polyps. If you are learning something useful, please subscribe. It tells the algorithm to show evidence-based videos to more people who need them. Warm showers or gentle humidification can thin secretions, a practice widely recommended in patient education by the Mayo Clinic. External nasal strips can mechanically lift the sidewalls of the nose at night, which some patients find helpful for mild obstruction, as noted by clinicians in American Academy of Otolaryngology Head and Neck Surgery guidance. Sleep with your head slightly elevated and stay well hydrated because thinner mucus is easier to clear, according to the Mayo Clinic. Short-acting topical decongestant sprays such as oxymetazoline can rapidly shrink swollen turbinates for a few days. A review in the Journal of Pharmacy Practice explains how overuse can lead to rebound congestion, also called rhinitis medicamentosa. Non-sedating oral antihistamines like cetirizine or loratadine help sneezing and itching in allergies, as outlined by the Mayo Clinic. For constant watery drip, ipratropium nasal spray can reduce secretions, according to clinical practice resources from the American Academy of Allergy, Asthma, and Immunology. For children and infants, pediatric guidance from the Mayo Clinic favors saline drops and gentle suction and warns against inserting objects or oils into little noses. For pregnancy, the Mayo Clinic notes that saline is safe and that budesonide nasal spray and non-sedating antihistamines are commonly used, while many clinicians avoid oral decongestants in the first trimester. For people with asthma, recent surgery, or frequent nosebleeds, the American Academy of Otolaryngology Head and Neck Surgery recommends avoiding irritants and seeking personalized care. Seek care if symptoms last longer than 10 days or worsen after getting better, as the Mayo Clinic advises. See a clinician for high fever that persists, severe facial or dental pain, swollen eyelids, or changes in vision, because these can indicate complications, according to Mayo Clinic guidance. One-sided blockage, foul smell, or bloody discharge should be checked, since ear, nose, and throat specialists note that these can signal a foreign body or other conditions that need direct examination. The Canadian Respiratory Journal experiment with menthol shows how sensation can trick us, so a burning nose can feel open even when airflow is unchanged. The Cochrane database of systematic reviews journal highlights how few controlled trials exist, which leaves a vacuum that anecdotes fill. Experts at Mass Eye and Ear explain that dramatic videos spread quickly, while careful negative studies are less shareable, so our brains remember the miracle stories and forget the quiet data. Putting garlic in your nostrils is not effective and is not safe. The Cochrane database of systematic reviews journal finds no clinical support for intranasal garlic, and the Food and Drug Administration and the Centers for Disease Control and Prevention. National Institute for Occupational Safety and Health warn about unsterile or irritating nasal practices. Clinical Otolaryngology and Allied Sciences Journal and Canadian Respiratory Journal Both teach us that sensory tricks are not true decongestion. Choose methods that lower inflammation, reduce swelling, and safely clear mucus instead of chasing a sting that only feels like relief. If you experimented with garlic, remove it gently and do not push anything deeper. Rinse your nose with sterile or previously boiled and cooled saline, exactly as the Food and Drug Administration describes for safe irrigation, and clean your device after use. If you now have burning, swelling, persistent bleeding, or trouble breathing, seek care promptly. Following the Mayo Clinic guidance on when to see a clinician. First, sensation is not the same as airflow, as shown by Clinical Otolaryngology, an Allied Sciences journal, and the Canadian Respiratory Journal. Second, there is no proof that intranasal garlic treats congestion, and authorities like the Cochrane Database of Systematic Reviews Journal and the American Academy of Otolaryngology Head and Neck Surgery point to safer, proven options. Third, what actually works is simple. Sterile saline rinses, daily steroid sprays for allergy, smart use of decongestants, and basic home care. You can breathe better without burning your nose. This video is educational and is not medical advice. Tell me in the comments which health myth you want us to bust next, and share this with a friend who could use science-powered breathing relief.